We see a wide variety of knee conditions. Patients come to us for various reasons. I think the majority of people that we see are in the chronic state, right? It's been there for a really long time. I've talked about that extensively. But we do see people who come in with meniscus tears, probably most common, because a lot of people do their own research. They look on Google and they see that maybe the meniscus surgery isn't the best option. So they're looking for alternative solutions to help them because they're still in pain. They still can't function as well as they like. But we see a wide variety of stuff. We see a lot of runners. We see a lot of athletes, people who have direct injuries to their knee that aren't catastrophic, right? Because when they're catastrophic, they usually don't come to my office. They don't make it here. They're usually at the ER, and once they get their diagnostic studies, they're usually at the ortho's office because they need surgery. But for everything in between, where it's what I call sub-threshold, where it's not catastrophic, it's not unstable where they can't function, or completely severe where they need immediate attention. I talk about this a lot. When surgery is a choice because you're trying to deal with symptoms, then it may not be the best option. When it's not a choice, you don't have a choice. You're going to make the choice to get surgery because it has to be surgically repaired. And in those circumstances, surgery is absolutely a fix. So think of things that are completely broken. They have to be surgically repaired. But things that are partially damaged, where we're just dealing with pain patterns, and we really have a choice at this point, where the surgeon's telling us that they recommend surgery, and you're going to get second opinions, and maybe that's not the direction you want to go in, then it's very likely that in a regenerative environment we can help you heal. If anything in this video resonates with you, or you have any questions, please feel free to reach out to our office so that we can help.